Hi again. So I've just done a morning in the practice and no real communication that I can see on social media or on the powers that be websites. Somebody's one of my Facebook colleagues is a chair of conservative dentists, Sejal Pansali, and she's had a long conversation with the chief dental officer. And she pressed her on the concerns for our profession. The chief dental officer is aware of our unhappiness, but sounds under pressure herself, according to my colleague online. It's not good enough, really, is it? How come the other chief dental officers for the other regions have posted guidance? I'm getting calls from solo practice owners who are worried about what to do. My own associates are asking me, are we supposed to do this filling? Can we do this? Can we do that? And really, we need some clear-cut guidelines. And also, the second part is that we as professionals, as healthcare professionals, we could be used in a better way. If the NHS is going to get swamped if we close and the NHS gets swamped with dental emergencies, I wonder, would it not be better if we had guidance and direction to maybe organise some local emergency centres so that not all of us need to keep coming in for individual patients, and we could direct them to a particular centre. I'm sure locally our area team are probably working on this with the out-of-hours providers, but again, not really had any direction, and it seems rather disjointed. Don't get me wrong, I do appreciate this. There's a big mobilisation going on across government. I totally get that, but I would have liked some clarity. I think that's the word of the day. And then I noticed that one of my colleagues has asked some really good questions about being pregnant at this time. I'm seeing that in hospitals they're being told just to put on a decent mask and crack on, and there's no real argument.
Sorry.
That's fine. There's no real cover for people working in hospital as well. So it's not just us in primary care; it's secondary care that's also feeling the brunt of this lack of clarity. My heart does go out to those who are pregnant and working amidst patients who are potentially carriers or likely carriers and potentially infectious. So I'm at a loss. I'm just doing the best I can, giving my mobile number out to my elderly patients who are living alone and maybe will need help from us. And I urge you, and I'm sure you guys are doing that anyway, is just look after your elderly relatives certainly, but also your elderly patients, and I hope that there will be further information forthcoming, but I don't intend to hold my breath. Take care, guys, and I'll speak to you soon.